All right, guys, so today we're going to go over case study number 2. We did an assessment last night on one of our clients who's been having some elbow discomfort during boxing. And our goal is to keep them training and maybe help bring the whole system up with addressing some other things and maybe take some strain off this right side. So what we found was limitation in both flexion of the hips, limitation in external rotation of the right, internal rotation of the left, bilateral internal rotation on the shoulders, a little bit of bilateral external rotation on the shoulders, and overhead flexion on the shoulders. So we see this kind of superficial compensatory strategy on the upper torso in that we're missing some expansion in the front and some expansion in the back. On the hips, we have probably a pelvis that's turned towards one side, which is why we get one side different than the other. And we're hoping that if we can get this pelvis back a little bit, it might make it easier for this upper torso to do its job, all right, which then maybe will decrease the elbow stuff. So the first one we're going to do is a deep squat breathing position with the heels elevated. All right, because again, we're looking to get an expansive strategy because of the bilateral hip flexion assessment. So they're going to drop down into this deep squat position, mini bands around the wrist. We're going to keep our hands turned out. You can even rest your elbows on your knees if you really wanted to. And you're going to push your upper back behind you, tuck your chin a little bit, and push out, and then 5 breaths. All right, so again, in through the nose. We also had a pretty wide ISA, so we're going to get a really forceful exhale on the way out. Okay, our next one to pull that pelvis back around to the other side is our right side lying adductor pullback. So what we're going to do is we're going to put our feet on the wall. Our knees and hips are going to be at 90-degree bends. I'm going to put something about 4 to 6 inches between my ankles. All right, I'm going to round my back a little bit, tuck my tailbone. I'm going to pull this left knee back as I breathe in, and then exhale and squeeze down as I breathe out. All right, and what I should feel is this left inner thigh getting some activation, or even this left outer hip getting a little bit of a stretch. All right, and every inhale, I'm trying to pull it back a little further. Exhale, squeeze down a little tighter. Inhale, pull back a little further. Exhale, squeeze down a little tighter. What I don't want to do is use this right leg. All right, it's pretty much all on this left hip that we're looking to get the activation on. All right, and then our last piece that we're going to go with is an anterior chest kind of expansion where we're going to line our back, our knees are going to be bent, we're going to tuck our tailbone just a little bit. I'm going to pretend like I've got a beach ball between my arms. All right, I'm going to hold them out there. I'm going to breathe in and pull apart. Exhale and soften everything. Inhale, pull apart. Exhale and soften everything. All right, what I don't want to do is bring it closer to me as I pull it apart. I'm pretending like there's that ball in between. And what I should feel is this anterior chest expand as I breathe in and then come back down as I breathe out. All right, what we saw was with those 2 of those exercises is a drastic reduction in hip stiffness, and we saw some shoulder mobility return as well. All right, so we're going to give that a try and see if that helps alleviate some of the discomfort when they're boxing, but also should make other things feel pretty smooth as well. And we'll keep adapting if we need to or adjusting as things change.